Elavil tablets is used to treat mental mood problems such as depression. It may help improve mood and feelings of well-being, relieve anxiety and tension, help you sleep better and increase your energy level. This medication belongs to a class of medications called tricyclic antidepressants. It works by affecting the balance of certain natural chemicals, neurotransmitters such as serotonin in the brain. Active ingredient amitriptyline. Indications. For the relief of symptoms of depression, endogenous depression is more likely to be elevated than our other depressive states. How to use. Dosage should be initiated at a low level and increased gradually, noting carefully the clinical response and any evidence of intolerance. Initial dosage for adults. For outpatients, 75 mg of amitriptyline hydrochloride a day in divided doses is usually satisfactory. If necessary, this may be increased to a total of 150 mg per day. Increases are made preferably in the late afternoon and/or bedtime doses. A sedative effect may be apparent before the antidepressant effect is noted, but an adequate therapeutic effect may take as long as 30 days to develop. An alternate method of initiating therapy in outpatients is to begin with 50 to 100 mg amitriptyline hydrochloride at bedtime. This may be increased by 25 or 50 mg as necessary in the bedtime dose to a total of 150 mg per day. Hospitalized patients may require 100 mg a day initially. This can be increased gradually to 200 mg a day if necessary. A small number of hospitalized patients may need as much as 300 mg a day. Adolescents and elderly patients. In general, lower dosages are recommended for these patients. 10 mg 3 times a day with 20 mg at bedtime may be satisfactory in adolescents and elderly patients who do not tolerate high dosages. Maintenance. The usual maintenance dosage of amitriptyline hydrochloride is 50 to 100 mg per day. In some patients, 40 mg per day is sufficient. For maintenance therapy, the total daily dosage may be given in a single dose, preferably at bedtime. When satisfactory improvement has been reached, dosage should be reduced to the lowest amount that will maintain the relief of symptoms. It is appropriate to continue maintenance therapy 3 months or longer to lessen the possibility of relapse. Usage in pediatric patients. In view of the lack of experience with the use of this drug in pediatric patients, it is not recommended at the present time of patients under 12 years of age. Contraindications. Amitriptyline hydrochloride is contraindicated in patients who have shown prior hypersensitivity to it. It should not be given concomitantly with monoamine oxidase inhibitors. Hyperparetic crisis, severe convulsions, and deaths have occurred in patients receiving tricyclic antidepressant and monoamine oxidase inhibiting drugs simultaneously. When it is desired to replace a monoamine oxidase inhibitor with amitriptyline hydrochloride, a minimum of 14 days should be allowed to elapse after the form is discontinued. Amitriptyline hydrochloride should then be initiated cautiously with a gradual increase in dosage until optimum response is achieved. Amitriptyline hydrochloride should not be given with tisopride due to the potential for increased quart interval and increases for risk of arrhythmia. The drug is not recommended for use during the acute recovery phase following myocardial infarction. Warnings. It's best to take your Elavil in the evening or before you go to bed. This is because it can make you feel sleepy. You may start to feel better after 1 or 2 weeks, but it can take 6 weeks for Elavil to work as a painkiller. Elavil can cause extra side effects if you stop taking it suddenly. Talk to a doctor if you want to stop taking it. Elavil is also used to treat depression, but at lower doses it's very good for treating pain. Side effects. Drowsiness, dizziness, dry mouth, blurred vision, constipation, weight gain, or trouble urinating may occur. If any of these effects last or get worse, notify a doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. To relieve dry mouth, suck on sugarless hard candy or ice chips. To sugarless gum, drink water or use a saliva substitute. To prevent constipation, eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative. Ask your pharmacist which type of laxative is right for you.